Hi, guys, welcome back to Med Nuggets. Today, we're going to talk about a very sensitive topic suicide. According to the WHO, over 700,000 people take their own life each year. That's one person every 40 seconds. NSH Digital reports that 1 in 5 people have suicidal thoughts, 1 in 14 people self harm, and 1 in 15 people attempt suicide. Every suicide is a tragedy that affects families, communities, and entire countries, and has long lasting effects on the people left behind. In 2019, suicide was the fourth leading cause of death among 15 to 29-year-olds. And over 77% of suicides occurred in low and middle income countries. However, suicides are preventable with timely and cost effective interventions.
So let's first look into who is at risk of attempting suicide so that it will help us in helping these individuals and paying more attention to them. And it will also help you identify if you are one of the individuals who are at risk, which will allow you to seek help from health professionals and your family and friends. Although attempted suicide is more frequent for women, men are more likely than women to complete suicide because they typically use more lethal methods like firearms.
Yeah, so let's look into who are at risk of suicide. A person may be at risk of suicide if they had a previous suicide attempt, a history of depression and other mental illnesses, serious illnesses like chronic pain, criminal or legal problems, and if they have job financial problems, impulsive or aggressive tendencies, if they are into substance abuse, if they had a current or prior history of adverse childhood experiences, a sense of hopelessness, violence, victimization, and perpetration.
Yeah, and not only that, even bullying can cause people to commit suicide.
Yeah.
A family history of suicide, or even a loved one's history of if one of your loved ones has committed suicide in the past, that can cause you to commit suicide. And also loss of relationships or violent relationships. Things like social isolation and lack of access to healthcare, and also suicide cluster in the community, which means if a lot of people in the community are committing suicide, that will cause you also to commit suicide. And also community violence, historical trauma, and even discrimination, things like race, gender, disability, or sexual identity. Even these things can can cause you to commit suicide. Actually, a survey found that 1 in 4 Black, transgender, and non-binary people, they attempted suicide in the past year because of things like discrimination, physical threats, or harm based on their sexual orientation and gender identity. These people were more likely than their peers to experience things like anxiety, depression, violence, and even homelessness. And the authors of this study, they suggested that strong family social support can help reduce suicide in this cohort of people.
Yeah, and even I read an article where it said that the social condemnation of suicidal thoughts and behavior, that is, suicide stigma, is an additional stressor to people who experience or have experienced suicide. A negative perception is, frequently held of suicidal people, right? Labeling them as weak and unable to cope with their problems or selfish. And also, this suicide stigma is considered to be a central barrier to seeking help. Seeking help for an disclosure of suicidality. So, whether you're considering suicide or know someone who feels suicidal, learn suicide warning signs and how to reach out for immediate help and professional treatment. You may save a life, your own or someone else's.
Yeah, so what are these so-called suicide warning signs? Right. So if a person is constantly talking about suicide or death in general, or as if a person is struggling to communicate, or if someone is talking about going away or referring to things they won't be needing and giving away possessions. And if a person is talking about feeling hopeless or feeling guilty, if they are pulling away from friends or family and losing the desire to go out, if they don't have a desire to take part in favorite things or activities that they used to enjoy once upon a time, or if they're having trouble concentrating or thinking clearly, if they're experiencing any changes in eating or sleeping habits, and if they're engaging in self-destructive behaviors like drinking alcohol, taking drugs, or cutting themselves, right? These are the warning signs of suicide.
Yeah.
right? So the thing with warning signs is warning signs aren't always obvious, and they can differ from person to person. For example, some people make their intentions clear while others can keep suicidal thoughts to themselves, right? They can keep it a secret.
Yeah. So I think people, they are better able to cope when they have at least one person who believes in them and wants the best for them,
Yeah.
and in whom they can confide in, right?
Yeah.
So it also helps to keep in mind that most of your problems, they're temporary and they can be overcome. Every problem has a solution, right?
Yeah.
So when struggling with problems, try to tell someone you trust what's going on with you. Be around people who are caring and positive. Ask someone to help you figure out what to do about a problem you're facing. Or work with a therapist or counselor if problems are getting you down and depressed, or if you don't have a strong support network or feel like you can't cope, then you can always go to a therapist or a counselor.
Yeah. So, how can you help a friend? So, if you feel like someone might be thinking of suiciding or considering suicide, then start a conversation with them. Because sometimes, even just talking it out with a friend can help that person feel less alone and more cared about and understood, right? And also, talking things through can give the person a chance to consider other solutions to problems. Because people who are depressed are not as able to see answers as well as others because their mind is clouded, right? So you could work with them and help them come up with at least one other way out of a bad situation.
Yeah, and if necessary, you can contact a suicide crisis line. These services are confidential and run by people who are happy to talk to you to help you figure out what to do. Sometimes teens who make a suicide attempt or who die from suicide, they give no clue beforehand. So this can leave loved ones feeling not only shocked but guilty and wondering if they missed something. So it is important for their family members and friends to know that sometimes there is no warning sign, like we mentioned before, and that they should not blame themselves.
Definitely. And if you've been close to someone who has attempted or committed suicide, it can help to talk with a therapist or a counselor, because these people are, because therapists and counselors, these are people who are trained in dealing with these kind of complex issues. Or you could even join a group for survivors where you can share your feelings and get the support of people who have been in the same situation as you, right?
Yeah, so take care of your mental health as well.
Yeah.
So remember, suicidal feelings, they're temporary. If you feel hopeless or that life's not worth living anymore, remember that treatment can help you regain your perspective and life will get better. So take one step at a time and don't act impulsively.
Yeah. So I guess that's it. That brings us to the end of our podcast. Hope you learned something from this and can help save a life in the future.
Yeah.
So have a great day and bye
See you
bye.
next
See you
time.
soon.